Hello, Professor Hardy. I'm here. My name is Megan Monaro. I'm here with Lily Carter, Olivia Hartenstein, Rita Iqbal, Michaela Mize, and Leticia Sanchez Montes. And we are here to present our Topic 7 CLC group presentation on human resources and change. So to kick things off, I'd like to provide a quick overview of United Healthcare and explain why we chose this company for our project. United Healthcare is one of the biggest health insurance providers in the country, and it's part of the larger United Health Group. In 2024, it covered around 51 million people through employer plans, Medicare Advantage, Medicaid, and prescription drug coverage. United Health Group as a whole brought in over $400 billion in revenue that year, up 8% from 2023. So it's safe to say this company has a major presence in the healthcare world. We picked United Healthcare not just because of its size, but also because of the growing concern about how it handles insurance claims. After the tragic death of one of their executives, public focus turned to the company's role in denying care. One Reuters article put it plainly: many Americans blame insurers for delaying or denying care and causing patients to suffer. That's why this company is such a strong example. It shows how the decisions made by large insurers can affect people's access to care and how much trust the public places in the system. Now, Leticia is going to explain what the problem or issue is.
All right, hi, my name is Leticia. Today we will be diving into the claims denial process at United Healthcare, explaining what it is, the problem it causes, and potential solutions to improve the system for both healthcare providers and patients. We're going to start with what is claims denial. Claims denial occurs when United Healthcare refuses to pay for certain medical treatments, procedures, or services. This refusal can stem from various issues such as non-coverage of specific procedures, administrative mistakes, or discrepancies in the documentation provided. What are the key points? Well, denial is not necessarily a reflection of the care provided, but rather a process issue. It's important to understand this because claims denials can impact both healthcare providers and patients. All right, next slide, please. Okay. Problem identification, high volume of the denial claims. United Healthcare's claim denial rate is significantly higher compared with others in the industry, leading to widespread dissatisfaction. This is not only frustrating patients, but also creates a heavy workload for healthcare providers who have to manage these denials. Financial strain on providers and patients. Denial claims result in delayed payments to healthcare providers, which can cause financial strain. On the patient side, they might end up facing unexpected out-of-pocket expenses as well, which leads to confusion and in some cases delay or avoided care. Impact on customer dissatisfaction. The higher number of claims denial is directly correlated with a drop in patient satisfaction. This is not just a minor issue, it also affects United Healthcare reputation and the loyalty of its policyholders. Claims and reimbursement department. What is the challenge here? One of the main barriers for the claims and reimbursement department is the complexity of processing the claims. The sheer volume and intricacy of paperwork make it easy for mistakes to occur, leading to more denials. Need for change. To address these issues, there's a clear need for more transparent, automatic, and faster claims processing systems. This will reduce administrative burdens and lower the rate of errors. Potential change agents, IT professionals, claim experts, operation managers, and data analysts all play crucial roles in making these changes possible. How change could help? By streamlining the process of claims, we can speed up reimbursements to providers, improve customer satisfaction, and ultimately reduce the cost of administrative inefficiencies across the board. All right, next slide, please. Another impact that we can see is in the customer service department. With the improved claims process, customers will experience fewer frustrations and better communications from United Healthcare. Clearer explanations on why claims are denied and how to resolve them will reduce also confusion. Reduction in customer complaints. This transparency will directly impact the volume of complaints received by customer service teams with fewer claims disputes. Representatives will spend less time handling complaints and more time assisting with other customer needs. Next slide, please. Faster resolution times. An automated and more efficient claims process leads to quicker resolution times and for customers. This will positively influence customer satisfaction scores and reduce the common frustration that arises from long delays as well. The training and knowledge base for customer service. Staff training on new processes is essential that customer service representatives are properly trained to handle the update claims process. This includes understanding new tools and how to communicate the process of both patients and also healthcare providers. Expand the knowledge base. To empower customer service agents, they will need access to real-time systems that provide up-to-date claim status. The more information they have at their fingertips, the faster they can resolve the issues. Right, next slide. Implementation of the new systems and tools. This is another impact in the IT department, technology department. The IT department will play a pivotal role in rolling out automatic claims processing systems, which will use AI and machine learning to assess claims faster and more accurate. Integration of automatization and AI. This involves integrating new AI driving tools into the existing infrastructure. The automation will not only speed up claims reviews, but will also minimize human errors, improving overall accuracy. Data management, managing the massive amounts of data generated from automated claims will be another challenge for the IT team. They will need to ensure that the data is secure, easily accessible, and complies with all relevant regulations. Next slide. Wrap up. We have the conclusion. Improving the claims denial process will not only benefit the claims and reimbursement department, but will have far-reaching positive effects across customer service and IT. By adopting a more automated, transparent, and efficient approach, United Healthcare can enhance both provider satisfaction and patient care as well. The change is not necessary. It's inevitable for staying competitive in today's fast-paced healthcare environment. And now, Lily Carter, she's going to take over to this presentation. Thank you.
Hi, everyone. This slide dives into a comparison between two heavyweight contenders in the U.S. healthcare arena, United Healthcare and Kaiser Permanente, with the spotlight on how they manage claim denials. United Healthcare faces a daunting challenge, with about 33% of its in-network claims getting rejected. The primary culprits are issues with verifying eligibility, incomplete documentation, and automated assessments like Navi Health's NH Predict. While many of these denials can be overturned through appeals, the unfortunate reality is that most patients don't pursue this option, often due to a lack of awareness or the time it requires. On the flip side, Kaiser Permanente boasts an impressive claim denial rate of just 6%. Their integrated HMO model, where both the insurer and provider operate under the same umbrella, streamlines processes, minimizes administrative hiccups, and enhances the accuracy of claims. This seamless alignment not only results in fewer denials, but also elevates the overall patient experience. In fact, Kaiser's approach could very well be a game-changing blueprint for United Healthcare to improve its claim management practices. On to the next slide, please. Next, we have the satisfaction of three stakeholders. As we know, a stakeholder is a person, group, or an organization that is directly affected by a company's success. This means that if a company is having trouble, then the stakeholders are affected in their own individual ways. Three stakeholders that are directly affected by these changes are the investors, because with the change, the investors can see a change in the company's productivity and activity. Providers, because the change in providers will be compensated, and this will increase their number of patients that can afford to come back to seek treatment again, as well as affects their lifestyle. Customers, of course it affects customers, because whether or not they can afford the treatment and they understand how to obtain this treatment. And those are the three stakeholders that are most affected by the United Healthcare system. And we're going to go on to Rita for her slides. Rita, I think you're muted.
Sorry about that. Hello, everyone. United Healthcare takes a balanced approach to recruiting by leveraging both internal mobility and external hiring. This hybrid strategy helps retain talent already familiar with the company operations while bringing in fresh perspective from outside. Advanced AI-powered tools are used to screen resumes, match qualifications, and identify the most suitable candidate effectively. Structured interviews help reduce bias by ensuring every applicant is evaluated against the same criteria. Additionally, United Healthcare actively promotes diversity hiring through partnerships and organizations that connect them to under, underrepresented talent pools. This approach aligns recruitment with the company's diversity, equality, and inclusive goals. For compensation and benefits at United Healthcare, it offers competitive salary packages based on current market data, ensuring they remain attractive to top talent. Their benefits package includes comprehensive health, dental, and vision coverage, as well as retirement plans like 401(k). With company match, tuition reimbursement, and stock option, employees are rewarded through performance-based bonuses and annual merit increases, which incentive high performance. The company also places strong emphasis on work-life balance, offering paid time off, parental leave, and wellness incentive. These benefits are designed to attract new hires while also retraining existing employees by supporting their financial, physical, and emotional well-being. On to the next slide, please. Onboarding at United Healthcare typically lasts between 30 and 60 days. Depending on the role, the process combines virtual and in-person elements to provide flexibility and accessibility. It involves collaboration between HR, IT, and departmental supervisions to ensure that new hires are fully equipped with the tools, system access, and information they need. Onboarding focuses on helping employees understand company culture, meeting complaints requirement, and providing role-specific training. By blending general corporate orientation with department-level guidance, United Healthcare ensures that employees feel both welcomed and prepared to perform in their new positions. United Healthcare learning and developmental approach combines skill building programs with fact-based training such as competence and technological requirements. The company utilizes multiple platforms, including LinkedIn Learning, its internal U-Learn system, and instructor-led sessions to deliver content. L&D intuitive include career pathing and succession planning to prepare employees for long-term growth within the organization. Training occurs both on the job, allowing employees to apply knowledge immediately, and off the job for in-depth learning. This combination ensures that employees not only meet current job demands, but also develop the skills needed for further future leadership roles. Fourth step, performance management progress. Next slide, please. United Healthcare follows a structure, four-step process for managing employees' performance, planning, monitor, reviewing, and rewarding. Planning involves setting clear performance goals for employees, especially change accents so everyone understands what's expected. Monitoring ensures to track process throughout the year, providing coaching and support when needed. Reviewing combines objective measures like meeting service and quality benchmarks with subjective feedback on skills such as teamwork and patient communication. Rewarding recognizes and incentives outstanding performance, reinforcing their commitment to excellence. A key feature of the process is to use of 360-degree feedback, which gathers insight from peers, managers, and the employees themselves. This holistic approach helps team members understand their strengths, identify growth areas, and align their contributions with company goals. By following this model, United Healthcare not only supports employees' growth, but also ensures the workforce is consistently delivering the best possible care to their members. Now on to Olivia.
Hi, my name is Olivia Hartenstein, and this is my portion of the CLC project. Our whole presentation is on United Healthcare and different claim denials within that, and these are my slides. So for starters, I had the ethics portion. So the ethical viewpoint from United Healthcare is to help people live healthier lives and make the healthy system work better for everyone. That was said on United Healthcare's actual website. This highlights how the company strives to ensure every individual is taken care of and provided the services that they need. In addition, this viewpoint also highlights how the company looks for ways to improve their system and to ensure that all individuals' needs are met. In addition to this, United Healthcare focuses on bringing healthcare to many people. They stated on their website that they work with more than 1.7 million physicians and care professionals and over 7,000 hospitals and care facilities nationwide. This alone shows the mission that United Healthcare really strives for. With this, United Healthcare utilizes the utilitarian approach as it focuses on the well-being of people and minimizing harm. This sort of ethical approach helps to keep the company focused on the mission and maintain their overall ethical viewpoints. However, the claim denial situation, as mentioned in this presentation, that United Healthcare is currently facing does not align with their ethical viewpoint nor their ethical approach. The claim denial situation essentially means that they do not approve all claims that are submitted to the company, which means they're denying medical attention to individuals that may actually need it. An article by United Healthcare noted that these denials could be due to multiple different factors. Those factors are eligibility, duplicates, documentation, program integrity, coverage, and then clinical aspects. These aspects offer many suggestions as to why claim denials might end up making sense. But despite the logic that United Healthcare may be using and the reasons behind why they're, denying claims, there needs to be some sort of way that claim denials do not have such a heavy impact on individuals, especially those in desperate need of medical attention. For instance, an individual in need of immediate medical attention should not have to be worried about a claim being denied. So this aspect should be taken into consideration and changed, as well as realigning the company with both their ethical viewpoint and their ethical approach. To continue, my next slide was integration of faith, learning, and work. So this is now based on United Healthcare's integration of faith, learning, and work. So in the Grand Canyon University statement on the integration of faith and work, there are two statements that stood out most to me and can relate most to the issues of claim denial with United Healthcare. For starters, the statement states, "We believe that regeneration by the Holy Spirit is essential for salvation and that the work of God's Spirit in the human heart invariably results in renewed purpose and the growth of Christ-like love for neighbors and neighborhoods." So to further expand on this idea, Matthew 22:39 states, "And the second is like it, love your neighbor as yourself." And this was the Bible 2025. This verse essentially means that we should love other people and love them closely. The Christian worldview says that we have to give to individuals that are in need. In this case, United Healthcare is not following this standard as there are issues with claim denial. The claim denial issues are refusing healthcare needs to individuals that actually need them. This issue does not then show love like to our neighbors, nor does it follow the Christian heart on helping people. In addition, another statement that integrates perfect with United Healthcare is the statement stating, "We believe that the gospel message denounces evil and injustice while offering hope for reconciliation to Christ and the restoration of human culture and society through him." To further expand on this one, John 14:6 states, "I am the way and the truth and the life. No one comes to the Father except through me." Again, the Bible in 2025. This essentially means that we are to follow God in order to have a prosperous life. The Christian worldview tells us that we need to follow the principles that Jesus laid out by example while he was on earth. In this case, if United Healthcare followed these guidelines given to us by Jesus, then they would not have as many claim denials and issues with individuals. Therefore, United Healthcare is not following the Christian worldview nor the guidelines provided in the Bible. The claim denials do not show care, love, nor understanding and help towards individuals in need. Lastly, the Christian worldview perspective informs the team's handling of this problem by helping the group to focus on finding a solution that was more beneficial to individuals that face these claim denials. The main focus was to find a way that didn't harm the organization, but still improve the issues with claim denials and could really help different individuals out. In addition, the group suggested ways that were fair, timely, and efficient for those individuals. Finally, the group suggested solutions that connect closely to not only the statements and the GCU statement of integration of faith, learning, and work, but also the Bible verses that were mentioned in this slide just now. Overall, the team was able to find solutions that followed both the Christian worldview and God's guidelines in the Bible, while also working with United Healthcare and those individuals facing claim denials. So thank you for listening to my portion of the presentation, and the next slides are just to kind of conclude out this presentation. Thank you.